And welcome back. We've just heard what can you do to change the world and make it a better place, which is a great introduction also for our next chat. The U.S. President's emergency plan for AIDS relief, PEPFAR, has contributed over $1 billion for HIV/AIDS activities since its inception in 2003. Since PEPFAR began its partnership with Namibia in 2004, the number of HIV-infected persons has been reduced. Therefore, the United States works with the government of Namibia and partners to identify people living with HIV and to ensure they start and remain on treatment to prevent new HIV infections and to care for vulnerable children and other people affected by HIV and AIDS. With that in mind, we are now joined by Dr. Dziuban, Country Director at the U.S. Center for Disease Control and Prevention, as well as Dr. Abeje Zegeye, who is the HIV/AIDS team leader at PEPFAR USAID Namibia. Gentlemen, quite a mouthful. Good morning and welcome.
Good morning.
Morning.
Good morning.
All right. I suppose we're going to have some great news during this conversation, but let's start off with the PEPFAR representative. You can perhaps talk to us about the role and the aim of PEPFAR, what you aim to achieve, as well as the role that you are currently playing in our country.
Yeah. Well, thank you for having us. We're really excited about this. And you're right, we do have good news. PEPFAR has really been able to join with the government in Namibia and partners here to come a long way. Mm-hmm. We started in 2004, actually, quite a while ago, being in Namibia, partnering with the government, and it's really been terrific. The aim, like you said, is to try to control the HIV epidemic here. Yeah. As you know, Namibia has had a large challenge with HIV for quite a while, and Namibians have been working hard on this since the beginning, and we're joining together and trying to get really effective treatment for people living with HIV and prevent new infections of HIV. Yeah. So there's something called the 90-90-90 goals, mm-hmm. and these are set internationally. The idea is 90% of people with HIV knowing their status, 90% of those people being on treatment, and 90% of the people on HIV treatment having their virus suppressed to a level where it's not harming their bodies. Okay. Now, Namibia is ambitious, and the government actually has set goals for 95, 95, 95. They want to hit even higher. They really want to be leaders in Africa for this.
Okay. Very interesting, because the narrative when it comes to AIDS, especially on the African continent and here in Namibia, has been that it's quite an uphill battle, and it seems that something is working. It's giving in, hey? Mm-hmm. Dr. Zegeye, let's talk about the different organizations that PEPFAR is working with, or should I direct it to you?
Okay.
I can direct it to you. Yeah. Okay, that you're working with to carry out your mandate, and how crucial it is to have the right organizations to sort of work with.
Thank you for that question.
Yeah.
Basically, our big organization is the Ministry of Health, the government, mm-hmm. and majority of the PEPFAR partners and organizations are local partners, indigenous partners. Of course, we are looking to increase our local partnership, mm-hmm. to build their capacity. But basically, when we see the outcome of some of our PEPFAR organizations, either local or international organizations, in terms of their outcome, quantitatively, we supported the ministry with the best interest of the ministry to develop the guidelines, to update the national guidelines, training curriculums, at the same time also provide mentorship trainings, and also share best practice, not only from other country to Namibia, but also from one region to the other region. Mm. There are a lot of best practice, a lot of good work interventions. Mm. So our partners, our implementing partners organizations, to facilitate the best practice sharing and all those things. Quantitatively, compared with where PEPFAR started, as Eric mentioned, since 2004, we have tremendously increased the number of facilities providing HIV prevention care and treatment. Even currently, some of the small facilities in Namibia are providing HIV prevention and treatment services. At the same time also, if you look at the number of people we are putting on treatment, it has increased tremendously. And as of last year, we put about 19,000 patients on treatment. And we are testing more than 350,000 clients per year HIV testing.
Wow.
And at the same time, mitigating the impact of HIV/AIDS, providing comprehensive OVC programs, and at the same time also generating real-time data, either doing surveillance, research, operational research, even the program data itself. And also we are looking, the partners are really looking at real-time data to generate where is the gap, which age groups, which population groups are we missing, and so on and so forth.
All right. And speaking of having access to this data, for our viewers' sake, which age group is severely affected? I mean, Dr. Dziuban, you're working with the Center for Disease Control. You have these numbers. You've reduced deaths from 10,000 per year to 4,000 between 1991 to 2004. But what age group are we really looking at that needs to be targeted?
Sure, yeah. We know that people of any age can have HIV, right? Babies can have it passed on from their mothers during birth or during breastfeeding. People can get it at any age. What we've seen in Namibia is one of our biggest challenges is with young people, adolescents, and particularly young men not knowing their HIV status. So really getting tested for HIV is a smart choice for any Namibian. It's quick and easy. I think people are surprised by how fast you can get your results. It's immediate. And then if you are living with HIV, you can get on life-saving treatment right away. So young men is where we want to really target and make sure they know this message. And I hope any young men watching today who are considering getting an HIV test will go out and take that step for their health and for their families. But really anybody, getting tested is important, getting on treatment. And then if you find out that you don't have HIV, you can take steps to really prevent it and stay HIV-free for the rest of your life.
And perhaps encourage someone else to go for that test.
Yes.
Let's talk about some of the other crucial challenges that you have experienced. What are those, just briefly?
Thank you for that question. Of course, as any program has its own challenges. While we are celebrating some of the achievements, the key challenge we can see in terms of prevention, there are some populations that we haven't yet reached. That is reaching unreached, hard to reach populations. That is really critical because...
Which are those?
For example, the adolescent girls and young women, the key populations which we haven't reached, even in the community where there is hard to reach areas. These are the areas we are looking, some of the areas we have to design a strategy to reach this population. In terms of HIV testing, as I have alluded earlier, we are testing more than 315 communities on HIV, but in terms of the main aim of testing is to identify positives. So sometimes we test all the population, but identifying the HIV positives to put on treatment, that is also one gap we are looking at, how we can improve to identify more positives, especially by providing a type of index testing. When you find one index positive, then track the family, the partner, the friend to test and to find more positive. In terms of treatment, recently we started to roll out to test and treat all the HIV positives. But before that, there was using a type of parameter of HIV viral load or CD4 count we are putting on them. But currently, we are putting all patients who are positive on treatment. That was one of the main challenge sometimes. And the other challenge is that the data system, the data that we are using, we have identified really critical where is the data gap, which age group we are missing, which population we are missing. So these are some of the challenges that we are looking and critical areas.
All right. Thank you, Dr. Zegeye. Very interesting. You've got the data. You've had so many achievements. Unfortunately, we are out of time. But just briefly, just to round off on a positive note, what are the other achievements, just quickly?
Yeah. Well, one that's really exciting, I think, for any Namibian is to know that the number of the babies who are infected, babies who are born to mothers living with HIV, the number of those babies that are positive themselves used to be 30%. It's down to less than 5%. And there's now clinics that follow hundreds of babies, and 0 of them last year becoming infected. That's a huge achievement for Namibia.
That's a big deal.
Yeah.
Gentlemen, doctors, thank you so much for coming in.
Thank you.
Thank you.
Right, there you have it. Some great news this morning, focusing on the work that PEPFAR does, as well as the Center for Disease Control and the achievements they've had. I hope we stay on that upwards trajectory of making some positive change. Hey, do stay tuned. We'll be back with more.